You're watching TheMediTube.com, India's first doctor-to-doctor TV.
As I said, the brachial plexus injury, the diagnosis is very important. The early diagnosis helps both the surgeon and the patient to get a good recovery. Here the diagnosis means you must identify the level of the injury and the type of injury. If you see a patient with the intact serratus anterior muscle, that means the roots are intact. And if further you see the supraspinatus and infraspinatus muscle are working, then the lesion could be beyond the truncal level. And in cases where patient has a good hand function and extended elbow, but the shoulder is drooped and the elbow is not able to flex, this limits to a lesion which is upper trunk lesion. The whole limb is flared. It's called the global palsy, when all the nerves have been disconnected from the spinal cord. So it's very important to make out the lesion first. Similarly, Horner syndrome with ptosis, meiosis and hydrosis on the affected side points to the avulsion lesion. Thus, you have to fix the lesion, whether it is an upper trunk lesion or a lower trunk lesion, because the middle trunk lesion is not noticeable. Further, to confirm the diagnosis, we do an X-ray chest which shows a raised diaphragm. That means the phrenic nerve is avulsed, divided or ruptured, which denotes the severity of the lesion. X-ray of the arm will show the fracture of the clavicle, fracture of the humerus, again to say that this is a very major injury. Then your medical resonance imaging will show by way of pseudomeningocele in the case of avulsion injury. And sometimes they show the thickened nerves which indicate that either there is a neuroma in continuity or will be a rupture of the nerve which is amenable for repair.